Hi, this video is the art of hair transplant restoration surgery on a black African American man who has a class 6-7 hair loss pattern, 6 hair loss pattern, and pretty much he's losing completely from the front to the back, and his tempo has gone back. So, and a case like this, you're going to need more than one surgery, FUE or the strip method. With the strip method, we can harvest around 4,000 or 4,500, and it covers pretty much front to the back. But if you want perfect density, then you probably need more than one surgery. Something like this, you're looking around 6,000 to from 5,000 to 10,000. It just depends how big your hair is and what type of density you're trying to achieve. Great thing about his hair is he has curly hair. So curly hair tend to give a better appearance than straight hair, and a thicker hair tend to give a better coverage. So for black men, from the mid eyebrow to the hairline is 6.5 to 7 centimeter, and mostly hairline is just almost straight curve across. For Caucasian men, is from the eyebrow to the hairline is around 7.5 to 8.5, and the hairline is a little bit archier. And the tempo we gotta bring in. Of all ethnicity, the tempo is the most important for black men, because it really frames the face. Because you not only have to lower the hairline, but if you don't bring the tempo in, then you have a really wide forehead, and it's still gonna look funny. So we'll bring the tempo in. If you turn this way, for Caucasian, the angle of the tempo is most acute backward. Asians less, but black men it's almost perpendicular. For women, it pointed toward the middle. And then for the hairline, once we get the shape down, we will zigzag. Now the zigzag for black men is tighter, smaller. Why? Because most black men like to line the hair up anyway. If we do such a big zigzag, then the hairline will be much higher. Other ethnic like Asian and Caucasian have bigger zigzag. The angle of the hairs for Caucasian and Asian is around 35-45. For black, it's really hugged against the skin, so it's almost like 15 degree, and the hair angle is like pointed down. Not only the hair angle is important, the selection of hair graft is important. We transplant rows and rows of single hair graft in the front, followed by a group of 2 hair, 3 hair, and 4 hair in the back for broken volume. We'll be attempting to do FUE of 2,500 graft today. If I can get more, then we'll get toward the middle. And since he has a pretty large head, the 2,500 will cover not half of them, but close to it. But 3,000 will definitely cover half of his head. And again, the more he do, the better it is. And a year later, we will march toward the back. The great thing about the FUE is minimal scar, and has revolutionized the hair industry and allow most black men to do a hair transplant with a less visible scar in the back. And because with the old technique, the strip method or the FUT, it leaves that linear scar, and the scar is permanent for the rest of your life. You will never be able to wear your hair short again, and some people regret having the strip method linear scar. With the FUE, there is scar too. No surgery without scar. But the dots of scar is so scattered that it's hard to see, and they're small. And again, you gotta find someone who's specialized in the art of restoring black man hairline, and some client who is specialized in, some surgeon who specialized in the FUE on black men. Thank you.